So anybody who's watching this, I just want to introduce myself. My name is Hillary Gargata. I'm a board certified family nurse practitioner and owner of Healthy by Hillary, an adult health and wellness practice in Wylie, Texas. And I'm joined today by my colleague, Melissa Garcia, who's the other nurse practitioner who works with me in the practice. And we are hosting a direct primary care webinar this evening to give a little bit more information to our patients and anybody else who's considering joining the practice as a patient, some information about what direct primary care is and how that can potentially benefit you as a patient. Okay, so I wanted to be able to take some time and discuss a little bit about what direct primary care is, so that you can decide for yourself if this is something that's a good fit for you from a healthcare perspective. So what direct primary care is it is a membership-based healthcare program where a participant would pay a monthly fixed fee for a certain number of healthcare benefits that they may receive from a given practice. And so the way that this works for Healthy by Hillary is that our patients pay a monthly fee. In exchange, they get, this covers the office visit fees for any medical care or wellness care that they receive in the clinic. So that would include their annual wellness exam and up to 3 office visits per month. So these office visits could be something for a sick visit, a follow-up visit, or even for maybe concern about a new health issue that has come up. And so the way that this works is that those patients would be registered into the practice just like any other patient. They would sign an agreement that's a direct primary care agreement. This is like a contract. It basically delineates our responsibilities as a practice and then also indicates what the patient can expect as a participant in the membership program, and then includes what services are included, what aren't included, and then what the fees are and the payment schedule and what that entails. For our practice, I ask that my patients sign the agreement. It is not a legally binding contract. Of course, they can terminate it at any time. We do ask for 30 days advance notice before termination. And in exchange, those patients pay their monthly fee or pay the fee for the service either monthly or annually. That can be charged to a credit card or a debit card that they can pay for that, or they can pay with cash or check, however they prefer. So this is not a substitute for insurance. So although a direct primary care membership covers your office visit fees for visits to the office where you receive medical or wellness care, this is not a substitute for insurance. So we do encourage our patients to still carry some kind of commercial insurance coverage to provide them with financial coverage for things like serious illnesses that require hospitalization, surgeries, and emergency care. Now, we do some urgent care procedures in the office like suturing and then some minor injury evaluations, but of course we don't have access to x-ray or the ability to do sedation, so we can't do any kind of major urgent care procedures like reducing a fracture or repairing a very complex laceration that's really big and requires sedation. So of course, for those types of incidences, we want our patients to either go to urgent care or to the emergency department for that type of care. And if they're going to potentially have those kinds of healthcare encounters, then we do want them to carry some form of insurance to help them cover that. So this is not a substitute for health insurance. Patients who are eligible for this service are all of our patients over the age of 14 years. We are not offering direct primary care services to patients under the age of 14 because our practice specializes in seeing individuals who are over the age of 14. So for families who, maybe some of the family members want to enroll, but they also have young children under the age of 14, we encourage them to have their children seen by a practitioner who specializes in pediatrics. Although Melissa and I are board certified family nurse practitioners and we are qualified to see children, that's not our area of primary focus. So we feel that children under the age of 14 are best served by somebody who specializes in pediatrics and can cater to the needs of developing children. So, with regard to Medicare patients, we do encourage Medicare patients to review our Medicare disclaimer. I have opted out of Medicare, and so I am a non-participating provider in Medicare. So, none of my services or the services of Healthy by Hillary can be reimbursed by Medicare. That includes direct primary care services. So, as a membership-based healthcare plan or program, this, of course, the fees cannot be submitted to Medicare for reimbursement. Of course, these patients can still maintain their Medicare coverage for those kinds of healthcare incidents like severe illness, hospitalization, and surgery, or any kind of prolonged treatment or required specialty care that's necessary. So we do see Medicare age patients and patients who are covered by Medicare, but we just want to make sure that they understand that direct primary care fees are not reimbursable by Medicare, so they would not be able to submit those for reimbursement to their plan. And so for our patients, we're rolling out this kind of a new revamped plan that's a little bit different from the previous plan we had in the past, because we've had more and more interest in it. And with healthcare costs changing and the healthcare landscape really changing, I think that now is a great time to begin offering this service again. So the specifics of the direct primary care program, the monthly fee is $159 a month. Of course, this is as of September 16th, 2025. This pricing is subject to change, but any participants would be notified in advance and given the opportunity to make adjustments to their plan if that wasn't a good fit for them. But as of September 16th, 2025, the plan costs $159 a month. This includes the office visit fee for your annual wellness exam and 3 office visits per month. Now, these patients do enjoy some additional benefits besides just having more predictable healthcare costs. Of course, our direct primary care patients do receive priority scheduling when it comes to same day or next business day appointments. We do our best to get them in the same day for an urgent healthcare need or within the next business day as soon as possible, so that we can make sure that we're meeting their needs in a timely fashion. They also enjoy some other benefits in the practice with regard to some of our elective services and procedures. And this includes 10% off of those elective office procedures and services. So aesthetic treatments like neurotoxin injections, dermal fillers, chemical peels, and any of those aesthetic procedures, they are able to get 10% off. Any products sold in office, like skincare products, or any of our supplement products that we sell in office, they also receive a 10% discount as well, including IV therapy and intramuscular nutrition injections like Slim Shots and B12 injections. So definitely get a good discount on some of those elective services as part of their membership. And then the weight loss program that we offer, there's no additional fee for that weight loss program. So all of their office visits for the program are covered under their direct primary care membership. And so the only out of pocket that they would have for participation in the weight loss program would be the cost of medications. And so, when you're looking at the program as a whole, the benefits include predictable healthcare costs that you can kind of average out over the course of a year, priority scheduling and booking, and then discounts off of elective procedures and services in the office. So I would definitely like to open up the chat to anybody who has any questions at this time about what direct primary care is, or any of the benefits or inclusions that we offer along with it. So it looks like we had a question earlier that asked what services are included. We covered that a little bit, but I can go into more detail. So, when we talk about office visits, this can include a sick visit, it can include a follow-up visit, or a consultation for a new service or a new problem, such as somebody who would like to have a consultation for peptide therapy or a consultation for weight loss therapy. Those additional kind of complex problem visits, or even follow-up visits with regard to, if we've done any specialty testing like a GI effects or a Nutri-Eval, those complex problem follow-up visits would also be included. So no additional fee even for some of those more complex follow-ups. So we received another question. The next question would be, can someone use their HSA or FSA to pay for their membership fees and labs. Now, labs can certainly be paid for with HSA or FSA funds. And we do encourage our patients to do that because that is money that you're already putting into that account. So it's there for your benefit, and we definitely encourage our patients to use it. HSA and FSA funds work exactly like a credit card or debit card does in the office, and so there's no challenge with that. It can be a little bit tricky paying for direct primary care membership fees using HSA or FSA dollars. The legal ramifications of this are a little bit unclear, and so my recommendation to patients who are planning to use HSA or FSA dollars to pay for their direct primary care membership fees is for them to check with their particular plan. Different plans have different rules. And then some plans require submission of medical documentation for reimbursement from HSA or FSA, and some don't. So my recommendation, because there are so many different types of HSA and FSA plans offered by different providers, that if an individual was planning on using those dollars to pay for their membership, that they should check with their plan administrator first, just so that they don't get themselves into a situation where they have violated the terms of their agreement as far as their HSA or FSA is concerned. Otherwise, yes, I would accept HSA or FSA. So the practice does do that. Any other questions? So it looks like there's another question that says, what are the advantages of direct primary care? I think that the biggest overarching advantage of direct primary care is that your healthcare fees or your healthcare expenses are very predictable as far as any services that we offer in the practice. So if you're seeing us for primary care, those annual wellness exams, sick visits, follow-up visits on any kind of health issues that you're experiencing or any medical conditions that we're treating, then you, as somebody who maybe has a high deductible health plan, maybe uses a medical sharing plan, who is self-insured or uninsured, for those individuals, it helps with budgeting. So it really makes your primary care office visit expenses very predictable. You know that every single month it's going to be the same amount. There aren't any surprise fees or surprise charges. Anything additional would be aside from your membership fee. I think that does bring up a good point that I forgot to mention earlier. Of course, the direct primary care membership fee does not cover the cost of labs. So if you did come in for your annual wellness exam and you had lab work done, say you had, your cholesterol and your A1C checked and a pap smear and thyroid panel, those labs are not included in the direct primary care fee. It would be great if they could, but they're just, the cost of those labs just makes it cost prohibitive, and not everybody needs the same labs every single year. So we wouldn't really be able to include those and also be able to extend the same value to every patient. So any other questions about direct primary care, what our specific program offers, or any other individual questions? Nice. So we have another question. It says, for sick visits, can you do flu or COVID and other tests? So in our office, we do not charge additional fees for point of care testing at the bedside. So whether it's a flu test, COVID test, or a urine dipstick test to check for urinary tract infection, or a urine pregnancy test, those fees would be technically included. We don't typically charge for those tests. We just include those in the overall cost of any office visit, but that is a great question. So if you came in for you're a direct primary care patient and you came in for a sick visit and you were concerned about, COVID or the flu, and we did a COVID swab or flu swab in the office, there would not be any additional fee for that. Additionally, others, point of care or bedside procedures that are included would be EKGs. So for our direct primary care patients, we do not charge any extra for EKGs. So if you needed one for a preoperative medical clearance, or if you were coming in for a sick visit where you were having a cardiac related complaint or problem, then an EKG was deemed necessary at that time, there would not be any additional charge for an EKG as well. Okay, great. Well, I wanted to open up the floor just a little bit to Melissa Garcia. I know a lot of our patients are new to her. They haven't had a chance to meet her yet because a lot of them are still seeing me, but we're having more and more people scheduling appointments to see her. So, Melissa, if you don't mind, do you mind if I ask you to just give a little blurb about yourself and tell our patients just a little bit more about you so that they can get to know you and have a familiar face? So, if they do schedule an appointment with you, when they walk in the door, they'll know that the person that they're going to be speaking to is somebody who is already familiar to them.
Sure.
Thanks.
So I'm a family nurse practitioner. I've been in practice for about 6 years, and basically doing primary care in an internal medicine clinic. But prior to that, my nursing experience or nursing background was actually women's health. So I found this to be great to work with you and kind of continue that. Hormones, yay, go hormones. But otherwise, I don't really have like hobbies and stuff. I have two golden doodles. They're my favorite, best part of my life. I have 3 kids, and I'm kind of a pretty boring individual, but just hang out here at home and work hard. But that's it. I don't know if you all have questions, I can answer your questions.
Nice. That's great. I would say, you said hormones. What is your favorite part of treating hormone related conditions?
I love making people feel better. It's always awesome when patients come to you and they have multiple complaints and just don't feel like themselves, and just kind of helping to piece the puzzle together so to help them feel better and know that hormone is the result of that or lack of hormones. Just watching them, the transformation and feeling better and living a happier and more functional life is my favorite part, watching them go through that.
Nice. I think that that's a really great approach, and keeping the patient at the center in the forefront is that's just what we do here. I mean, that's the number one focus every single day. And if we can help somebody live a healthier, happier, and more functional life, then I think that that's our overarching mission for what we do every day. And that's a great fit. I love how you describe that. So it looks like at this point, let's see. I'm going to check to see if we have any other questions. I'm not seeing any additional questions coming in. So I feel like, this is definitely a new concept for a lot of people, but I think it can be a really great benefit. And some people, just enjoy having those predictable costs, knowing that they can stop into the office anytime they need to. And not worry about having to pay every single time. They just, sort of like a gym membership. We're here for them to be able to meet their healthcare needs and in a consistent and predictable way with no surprises. And we really pride ourselves on transparency and trying to be straightforward in our pricing. So I hope that this is helpful to everyone. Of course, anybody who wanted to see the webinar who didn't get a chance to, we'll have the recording posted so that it can be viewed later, and probably putting a link on the website, possibly just so individuals have the opportunity to see it if they have questions about it. So if there are further questions about direct primary care, what Healthy by Hillary's direct primary care program includes or doesn't include, or just any other comments on the issue or suggestions or recommendations, we are always happy to hear your comments and hear your feedback. And for anyone who has a specific question that pertains to their individual case, we would love to hear from you. You can always reach out to the office. You can email me at hillary@healthybyhillary.com. You can email Melissa at healthybyhillary.com. We're also always happy to receive comments on our YouTube channel or on social media. We do watch those and do like to respond. So we hope that this has been really helpful. I'm glad you had the opportunity to meet Melissa and hear a little bit from her, because she's a great asset to our team and we really love working with her. And so we're going to be watching for our direct primary care numbers to be going up soon. So definitely sign up while you can, because our roles do close at some point. Once we get full, we'll kind of know what that number is as we approach it, and we'll start letting people know. But there will be a cap to the number of direct primary care members that we can enroll. So if you are interested, I definitely encourage enrolling early. If you have questions about it and you want to schedule a phone call, you can always call the office at 972-520 526-5597 and request an appointment for a phone call if we need to go into a little bit more detail on it. So I hope this has been helpful. Thank you so much for attending. Thank you so much for watching, and thank you for all the great questions. And we look forward to seeing you soon.